brain. So we are going to talk about it in detail. Okay. Let me share my screen.
Yeah.
Can everybody see my screen?
Yeah, we can see now.
Yeah, you can see now. This is a small video, okay, of neurodiverse brain. How these brain are functioning. I would like to see every one of you, okay? You would want me to play one more time?
Yes, ma'am.
Yes,
Yeah.
ma'am.
Just okay. So what does this video say? Can you tell me what did you understand in this video? Can one of you tell me that?
We usually say that it breaks that stereotype that neurodivergent children brains are not broke. It works completely different, or not completely different, but it works different than neurotypical children. It doesn't mean that they have some issue, or it doesn't mean it's not working normally. It's just working in a different way.
Absolutely. It's not abnormal, it's not less, it's not faulty, but it's a different way of wiring. Since the wiring is different, they process information differently and they behave also differently, they respond also differently. Okay, that's what the video says. Okay, so now to understand that, we need to understand what is sensory integration. I'm sure all of you would have heard this word that this child is having sensory issues and because of that is not able to focus, is not able to attend, and because that we are not able to take him forward academically. I'm sure every one of you, those who are working with these kids, have faced it. Okay, so for that, to understand that, we need to understand what is sensory integration. So the simple definition, we take in information from our external sense and internal sense. Okay, we process, we organize this information so that we feel comfortable and secure, and then we are able to respond appropriately to a particular situation and environmental demands. This is sensory integration. Take in information, process, respond, feel comfortable, and organize. So what are the two aspect of this? The learning and some inappropriate behavior are the visible aspect of sensory integration. If the child has a difficulty with the learning, if the child is showing some behaviors, then we understand that this child is not having a good sensory integration. All of us are between 0 to 100%. Not that we have 100% of the integration. I'm sure all of us also have some of the sensory issues, like some of you can't tolerate the rough texture or a loud sound or too bright lights, something or other. We do have a sensory issue, but the strategies what we use are socially appropriate. But unfortunately, our kids, they don't use the strategies which are socially appropriate, and it looks like as a behavior. Within every child, there is an inner drive to develop sensory integration. And child uses each activity to develop a building blocks. From the time the child is born, sensory integration starts developing, because the moment the child is born, child takes in the information through the senses, from his internal senses, and processing happens, and child responds, and we see a lot of activity, the motor behavior, the sensory behavior. Okay, so that's sensory integration. And as I said, that all of us are between 0 to 100%. Not everybody has a 100% of integration, but we are able to manage in our everyday, day-to-day life. So when we talk about a neurodiverse brain, about 90 to 95% of the kids with the neurodiverse brain have a sensory issue. So this is something a part and partial of each neurodiverse brain. Their wiring is different. And since the wiring is different, they process information differently, and then they respond also differently. Is that clear? Okay. Sensory integration is the most important type of sensory processing. And the way we eat food, we eat food to nourish our body, the sensations are a nourishment for the brain. So more and more sensation the brain gets from the birth, the brain is nourished with lot of sensation. And so sensations are the food for the brain, and that's how the most of the schools are following the multisensory approach today, so that brain gets the information from a different senses, not only from the visual, from auditory, from kinesthetic, from tactile. All different type of sensations are going to the brain, and which is nourishing the brain. So it is a food for the brain. So the child who does not have a good sensory integration, we cannot say that keep him away from sensation. No, sensations are needed in the brain. That's a food for the brain. The child has to get a different sensation, but how the child processes that we need to understand, and accordingly we need to give a strategies to the children. Sensation provide the knowledge needed to direct body and mind. In absence of well-organized sensory integration, sensation cannot provide a vital nutrients to the brain for processing. Now look at this picture. What does this picture says? Feed the roots, not the leaves. So when I say the sensory integration, it happens at the lower level of the brain, which are the roots. What we call as it happens at the subcortical level of the brain. And when this sensation which going to the brain at subcortical level are processed and integrated in the right way, we are making the roots strong. And when the roots are strong, the leaves can also, a lot of leaves you can see, and the tree will flourish, okay, because of that. So when the sensations are organized and at the root level integrated well, okay, the child has a good cognition, no socially inappropriate behavior, academically child would be doing good, attention span would be good, his awareness, all that depends on how the brain is processing all the sensations. So anytime you see the child who's coming to you at 5-6 years old and come with some behaviors or a writing issue, reading issue, anything academically, if you feel the child is not progressing, child is stuck up somewhere, some behaviors are there, you need to think about how the brain is processing information. Does the child have a good sensory integration, or child is having some issue in one of the sense, one or the multiple sense also. So keep this picture in mind, okay, that whenever you come across, think of the lower level of the brain, subcortical level, where the sensory integration takes place. So we have spoken about the normal sensory integration. All of us take in information, we process, we respond. Now you people are listening to me, looking at the slide. Everything is going into your brain. the brain is processing and you are responding accordingly. And because of that, you are able to pay attention. You are able to grasp what I am saying because you have a good sensory integration, and it is happening unconsciously in the brain. You are not thinking that, oh, I'm looking, I'm listening, I'm looking at this also. Everything is happening unconsciously in the brain continuously. It's an unconscious process, taking in the information and responding to it appropriately. Okay. So what is a dysfunction? What we call as a SPD, or sensory integration dysfunction also. It is an inability to use the information received through the senses in order to function smoothly in daily life. These children cannot function smoothly. You will see some behaviors, you will see some learning issues, and the child will also have academic struggle and attention issues would be there. So when you come across that, think of SPD, called as a sensory processing disorder. Okay, it is not a specific disorder like a blindness or deafness. It's rather an umbrella term, cover a lot of neurological disabilities like autism, ADHD, LD, Down syndrome, children with cerebral palsy. All of them have some amount of sensory issue. And there are few kids, about 5 to 7% of the kids in the regular school, though they have a sensory processing disorder, SPD. They are not diagnosed, they may not have any other diagnosis, but purely processing disorder. And these are the kids that struggle in our education system in the regular classroom. About 5 to 7% of the kids are there which are not even diagnosed with any disability, but they are pure SPD. So these children may have an inappropriate, inconsistent response to sensory stimulation, difficulty in organizing and analyzing the information from the senses, limited ability to respond to the sensory information in a meaningful and an appropriate manner, difficulty in using the sensory information to plan and execute actions. All these difficulties children with sensory integration dysfunction will have. But the visible outcomes are some behaviors and learning issues. This already I have spoken. It is an umbrella term covering different disabilities like autism, ADHD, LD, Down syndrome, CP. Most of them will have a sensory integration dysfunction. According to the Jean Iyer is the lady who has proposed this theory long back in early 90s of sensory integration. And according to her, it is a traffic jam in the brain. The indigestion, as we have an indigestion of the food, so all the sensation which going to the brain are not processed in a right way. It creates a traffic jam in the brain. It creates the chaos in the brain. According to her, that is how the sensory integration dysfunction is described. Okay. Every child has an inner drive to develop a sensory integration through participation in sensory motor activity. How does it develop? Through the sensory motor activity. Every child, when they are born, okay, in 2 months, they are able to hold their neck, they will turn their neck, they will start tracking the object, they will turn, then they will sit, they will then start crawling, standing with the support. So all the sensory motor activity develops the sensory integration, and every child has an inner drive to develop that. Some will develop faster, some will develop later. That's what we see in neurodiverse kids like autism, LD or ADHD, Down syndrome. Sometimes you see that the motor system, the milestone may be delayed. In autism, we see a lot. And nowadays, according to the research, if there are some, you can say, fallout in a motor system, okay, at very early age, that child may have, in future, may get the diagnosis of autism or ADHD. So now it is been picked up very, very early through the motor system. You see some asymmetry, some fallout in the motor system. So these children are called as out of sync children, okay? Because of the way they process the information, they respond also differently. So they are called out of sync children. The responses can be different. It can be over responsiveness or a hypersensitivity, what we call. It can be a, sorry, somebody asked something. Jayashree, is anything I need to wait? Okay. So over responsivity, or we call it as a hypersensitivity. Okay. It can be a under responsivity or hyposensitivity, or it can be a seeker. They need a sensation more and more. We are going to talk about this in detail about every system. Okay. So till now I've covered what is normal sensory integration, what is a sensory integration dysfunction or a SPD. Okay. And what do you see? Some behaviors or the learning issue in these kids when they have a sensory integration dysfunction. Sensations are the food for the brain. It nourishes brain. Okay. So, yeah. So this is a classification of sensory processing disorder. It can be a sensory modulation issue, sensory-based motor disorder, sensory discrimination disorder. When I say the modulation, the child has a difficulty in modulating the information. It can be over responsiveness, under responsiveness, or a seeking. Three types you see in that. And now this three modulation issue you see in autism, ADHD, and LD. All three of them will have to some extent modulation issues. Okay. Next is a sensory based motor disorder. It is a dyspraxia. It's a motor planning issue. The child has a difficulty in planning a motor action. It also requires a cognition. And lot of kids with LD have a dyspraxia. When I see the child at 7 and 8, they come to me for a writing issue or a reading issue. When I do the assessment, I see these children are a dyspraxic children. The motor planning issue is there. Okay. So, but what happens? No, the parents, a lot of parents tell me, yes, we knew that there is something wrong, but we couldn't figure out what it was. Child was struggling in a different areas, but the parents feel that it's okay. But when it comes to then writing, where you need a maximum motor planning and a cognition, so that is a time child will struggle, and the parents will come to know from the school. The school would say he's not writing, not paying attention. Why don't you take a professional help? And by that time, it is very, very late. Okay. Another is a postural disorder. So this you see again in autism, LD also, and ADHD also. What do I mean by postural disorder? These kids are mainly very clumsy children, very floppy children. Their tone is less, their awareness about themselves is less. They don't know how to navigate the environment. Okay, they will bump into you, the way they will in classroom also, they will bump into other kids, the way they will touch you, the way they come very close to you, and they will look very clumsy. Okay, and they may not be good at the sports. The parents would always say, oh, my child doesn't like, he likes to sit and play, he's not more into outdoor play. So these are the kids, are children with postural disorder. This is a sensory based motor disorder. Third is a discrimination disorder. This mainly you see in LDs. Okay, they have a difficulty in discrimination in a visual sense, auditory also. A lot of kids with LD have a difficulty in processing the sound. Okay, they process it differently. Even the visual, they have difficulty in identifying the alphabets, or there will be a reversal. Again, It can be a discrimination in a proprioception or a vestibular. They don't understand how much my body need to move, how much movement is needed for me. Either they are too much or they do too less. Okay. The same goes with the taste and smell also. Is that clear? Okay. Any questions? These you will see wherever you work, and I'm sure you would have seen also this type of kids.
Yes, Sarvana.
One question, ma'am.
Go ahead.
This intellectual disability also part of whatever you're saying, right, ma'am? With ADHD, all that, autism,
Huh?
or is ID different from this?
No, I didn't get your question.
No, the intellectual disability also is under the same category, right,
Yes,
ma'am?
yeah.
Okay,
Children with
okay.
intellectual disability also have a sensory issue. But see what happens when cognition is less, okay? The behavior may start as a sensory, but then it get very established behavior, and then we treat it as a more of a intellectual disability behaviors, okay?
Oh.
But starts as a sensory only.
Thank you, ma'am.
Okay. Let me take this. Yeah, motor planning. If you are interested, I can take it. Okay. It's also called as a praxis. So children who have an issue with praxis, they are called dyspraxic children. Okay, it comes from a Greek word of action. The steps involved in a motor planning. Any action you need to do. First, you need to create an idea. Then you use your sensory feedback, determine the starting position. If the child is, say, has to get up and run, he will use the sensory feedback which previously his brain has gone through that. Okay. Initiation of the action. First is a creating an idea, then sequencing the steps required for the action, adjusting the action, adjusting the body according to the action, and stopping the action. So now when we see the motor planning issue child, it can be at any level. Okay, so we need to do a detailed assessment to understand, yes, the motor planning issue is there, dyspraxia is there, secondary to sensory integration dysfunction. So where the child is having an issue, from where do we start? Motor planning relies on the sensory feedback from the body and the environment, as well as on the language, memory, cognition, and thinking skill. So when we are doing the assessment, we need to consider all these things. The simple example, if any motor action the child or anybody has done and the brain did not get the good experience, okay, it remains in the sensory, in the brain. Next time when the child has to do that, that will come online. That negative experience will come online and child may avoid doing it. So why child is avoiding something, why is not doing something, you need to understand whether the brain has gone through any negative experience before, any trauma brain has gone through. That also decides the motor planning, how child is going to do it. Okay, it's a very complex process which involves many parts and functions of the brain. When different parts of the brain are involved in motor planning. Yeah, so this is a sensory based motor issue where you see the child will have a difficulty with the coordination, balance, clumsiness, body awareness issue, motor planning issue. You will see the gross motor, fine motor delay. They may not have a good postural stability, so the sitting posture may not be so good. When the sitting posture is not so good, postural stability is not good, the eyes are also not functioning, muscles are not functioning at their best. So child may get tired, the eye muscles get tired. So in a classroom, you will see the child may put down his head. Okay, sometimes they will do blink their eyes too much. That also can be a reason of not writing or difficulty with the writing. Discrimination, as I said, poor ability to discriminate touch, movement, force, position of the body in space. Lot of kids don't know how much pressure to be applied while writing. Either they will put more pressure or they will put less pressure. The gradation of force also decided by sensory integration. Do you want me to discuss the causes of SPD? You can read it on the net. So let me go through more of a intervention thing. Okay? Is that okay with everyone?
Yes, ma'am.
Yes, ma'am.
Yes,
Okay.
ma'am.
You want to just read the slide? Because in a classroom, if you are working as a special educator, you may come across a lot of kids, those who have only SPD. They may not be autistic, they may not be ADHD, only SPD. 5 to 7% of the kids in the classroom, regular classroom, have a SPD. It can be anything, prenatal, natal, or a postnatal. The child may have a SPD. What are the few early symptoms? Okay. Infants with the sensory issue, though, as I said, you will see something in a motor system, some fallout if this child is going to get the diagnosis of autism or ADHD or LD in future. Okay. Their milestone may be delayed. They may not move easily or gracefully. Their running may be awkward. They may look clumsy. Okay. Child may not play skillfully. The child would play, but it won't be that meaningful, purposeful play. That will be more of a repetitive play child might do. Okay. He may break things. Difficulty with jumping, climbing stairs. This may be delayed. Language development, speech may be delayed. Some children do not listen, though they may not have a hearing problem. That you see most of the kids, those who are going to have a diagnosis later in life, they may not respond, they may not look at you. Eye contact may not be so good. They may not, whatever instructions are given, they may not follow that. They may be very cranky, irritable, frustration tolerance would be less, stubborn behavior, a lot of anxiety, anxiousness will be there, repetitive play, difficulty with the social interaction. These are the very early signs you can pick up. Before 1 year, this can be, a lot of things can be picked up. Because all of us know early intervention is so good. So if you can pick up early, okay, if you feel some issue in the motor system and picked up by one year, and we start the intervention, because of the plasticity of the brain, these children can improve a lot. Because more stimulations are given in a right way, brain gets more sensation, lot of connection will happen, neural connection will happen, and the brain will start improving. Some of the symptoms, if are missed, okay, then the child may enter the preschool. And then what you see? The child may have difficulty in coloring between the lines. He would miss the details, may not follow the instruction given in the classroom, may not sit at one place, does not like a circle time. Given task would be confusing for the child. He may get angry, anxious, cry a lot. Hyperactivity, as I said, does not sit at one place, keep on moving around, following instructions may not be there. So now at this stage also, if it is picked up by 2.5, it would be really good, okay? Because plasticity of the brain is maximum, we can take advantage of it. Some are missed even early, preschool. Then the child has already entered the school. Child will be in senior KG or a first grade. Then the sensory integration problem that are minor in early childhood may become a major handicap for the child when he enters the school. These children will struggle a lot in the classroom, okay? Difficulty in making friends. They may get distracted with the noise, light, or lot of commotion or children in the classroom, okay? This child then need to compete in a sports with the children, those who have better sensory motor abilities. So again, the frustration, where the dent would be on their self-esteem and self-confidence. Then lot of confusion in the brain, which makes impossible to focus and concentration. The teacher may complain that he's not focusing, he's not attending, he's not listening. But if you see at back hand, there is an issue with sensory processing disorder, sensory integration issues are there. See, these children, if they are anxious, they are frustrated, they may hit someone in the class, they may push other kids. Okay, so the anger or hitting has nothing to do with the interpersonal relationship, but their automatic reaction to the sensation which they cannot tolerate. Then reading and writing would be an issue, and focusing, completing task, classwork, copying from the board would be issue. By this time, the child will, there may be a lot of verbal abuse also starts happening in the class. He is a stupid child, he does not understand. Other peers of the same age will also start understanding that this child is different, and they may start bullying him, they make a fun of him. Okay, the teachers will also start talking about that child is very slow in the class, he doesn't listen, he doesn't follow instructions. But there would be some issue because of that child is not doing. Okay, and that will impact his self-esteem and confidence, and which is a heavy burden on the child to carry. And this will have a lot of emotional and psychological impact on the child. So before, if it is known and addressed, this can be avoided. I would like to show you one slide here, which is a beautiful slide. I just love that slide. Yes. Beneath every behavior, there is a feeling, and beneath each feeling, there is a need. And when we meet that need, rather than focusing on the behavior, we begin to deal with the cause and not the symptom. Anything that child is doing in the classroom or outside, try and understand why he's doing what is he doing. There will be some cause of it, some difficulty child would be facing, and he would be doing. I have heard a lot of parents saying, oh, he's a lazy child, he doesn't want to do it. Every time he do that, he doesn't want to write, he doesn't want to read. First of all, try and find out, is there any problem child is having, why he's not doing what he's supposed to do. Never jump into any conclusion or assumption, oh, lazy child, he doesn't want to do, he just wants to play. No. Okay. Or maybe the child does not want to play a lot of time. If there is a dyspraxia, the parents would say, no, he doesn't like going out, he doesn't like to play in a garden, in a park. No, that's not, every child likes to go and play. Why he's not doing it, what the child is supposed to do at the age, if he's not doing it, we need to view it and understand why he's not. Be a behavioral detective and try and find out why he's not doing, or why he's doing what he's doing. Is that clear?
Yes, ma'am.
Yeah. Now let's go to sensory systems. Yes. Okay. So 5 external sense, everybody knows. 3 internal sense, vestibular, proprioception, interoception, correct? So total 8 senses, 5 external, 3 internal, continuously sending message to the brain. The brain processes it unconsciously and respond accordingly. Isn't amazing? Okay. Now let's discuss one after, vestibular system. Can anyone say something about it? Have you heard this word? Do you know anything about it? I'm sure the parents would have heard definitely about this. Can anyone want to say something about vestibular sense?
It helps us to recognize the position of the body in the space, like surrounding us.
Correct? Absolutely. Absolutely. So vestibular system plays a critical role in the modulation of all other sensory system. It is a fundamental to all our action. This is the first system to develop in utero. At the 10th week, this will get developed. Along with that, tactile will get developed, and the other system also starts developing. Okay. So this is a very, very important system. Our complete existence, it depends on our vestibular system. The receptor for these systems are located in the inner ear. It passes through our auditory system and it goes into brain. In the brain, everywhere you see the vestibular nuclei, and lot of areas you see the vestibular system all over the brain. Okay, it has a connection with the auditory and the visual processing also. It provides information about the gravity. Our relation with the gravity develops with this system. The first time when the child is trying to stand up, hold with the support, comes in the anti-gravity position, it's because of our vestibular system. Okay. All our motor actions through our vestibular system, it gets navigated. It tells us about whether we are moving or we are standing, we are moving in a which direction we are going, at what speed what we are going. So everything about us, our existence, is through this vestibular system. Now, can you imagine how important is this system? And when there is a fallout in the system in our kids with neurodiverse brain, how much these kids would be struggling. So much struggle these children would be facing, and most of the kids will have issue with vestibular processing. It also helps us to stabilize our eyes. When we are moving, our eyes are also moving. When we are reading something, focusing, it stabilizes our vision. Okay. So kids, when they have a writing, reading issue, first I will look for a vestibular system, whether the vestibular system processing is right or not. Is the child is struggling with this processing? We develop our relation to the earth through this system. Okay, so thanks to vestibular system for our upright existence, our body tone, okay, body muscle tone, everything is because of this vestibular system. Visual, auditory, olfaction, everybody knows that. Okay, I'm not discussing that, just read it. Proprioception. This is also very, very important system. Along with the vestibular proprioceptive system, they work together. Proprioceptive system is our inner navigation system, where we are in the space in relation to us and relation to others. Okay, so what am I doing now? I'm using my hands. My right hand is like this, my left hand is this, my head is moving. All this, who tells me? My proprioceptive system, what I'm doing, our inner navigation system. Okay. The receptors for this are in muscles, in joints, in bones. So when I'm moving my hand, the receptors from here send the message to the brain that my right hand is here, my right hand is moving, my right hand is doing this. So our awareness about ourself, okay, and our relation with the environment and with others, it is through our proprioceptive system, correct? It tells us about the spatial orientation of the body, body parts, rate, and the timing of the movements, amount of the force the muscles are exerting, how fast, how slow. So while writing, how much pressure to be applied. When I'm running, when I'm jumping, when I'm doing any other motor activity, how much force my body has to apply, it comes through this system. So if the child is not applying enough pressure while writing, you just tell him that, oh, put some more pressure. Why don't you put some more pressure? It's not possible for him to do that. It's not under his conscious control. We need to work on his proprioceptive system, activate proprioceptive receptors, and then the child's brain will learn it. Not by telling him that do that, not by showing him. See how am I doing? You also do that way. This is all useless. The child is not going to improve with that. In that, you are frustrating yourself and also putting too much of demand and pressure on the child's brain. Is it clear? Okay. How important this system is. Okay. So anytime you see child struggling with reading, writing, any other motor activity, gradation of the force, some children you will see they come very close to you. They don't know how much distance to be maintained between two people. Correct? They will touch inappropriately also at times. It's all because of the system. Introception. This is also very, very important. Okay. It is our inner, okay, whether we are our bladder is full, whether we are hungry, we are thirsty, do I want to go for a poo, is there any pain internally, all this is a introception. This sense helps the child to understand what is happening inside the body, and it has a direct impact on the emotions of the and the regulation of the brain. Internally, if something happening, if I have a stomach pain, or if my bladder is full and I don't understand, okay, because I'm hypersensitive to that, this will have an impact on my emotions and also has an impact directly on my attention and focus. It is a sense of internal state of the body. So in this also child may have a hypersensitivity. So little change also child may feel too much. And if it is a hypersensitive, there would be a lot of things happening, but child brain may not register. Many a times, why do they pee in the pant? Or they can't even say when they want to go for a poo because of the hypersensitivity of this interoception. Again, the child may be punished for this. Child may be, parents do a lot of conditioning for this, but it's not under his conscious control. How do he control, or how does he manage his behavior? It's difficult. So child will have a difficulty in regulating. Lot of time the meltdown happens because issues in a interoception. Tactile system. This is again a very important system. The receptors are all over the body, okay, under the skin. What we are touching, it is a soft, it is a hard, it is a hot, cold, all that sensation we get from our tactile system. Every activity in the daily life, like a dressing, combing hair, brushing, toileting, work at the school, are dependent upon a functional tactile system. This also developed in utero very early. Child can feel the sensation of mother moving, mother touching something, mother doing something. Child can understand that. Okay, it can be a light touch or it can be a deep touch. There are two pathways for this system: light and deep touch. The deep touch pathways are work along with the proprioceptive system. Okay. Okay. Let's do, yeah. So this is something commonly seen in the kids. Can be autism, LD, or ADHD, or Down syndrome, what we call as a hypersensitivity or a hyposensitivity. It is a modulation, how the brain is modulating the information. Okay. What do you mean by hypersensitivity? These children register the stimulation at a high sensitivity. Okay. They can hear frequencies and the intensity sound which other people cannot. So they are that auditory hypersensitive. They register, other people cannot register. This can be distracting and overwhelming for the kids, and it can be painful. Lot of people, those who have a hypersensitivity, they say that this sensation when we get, it is a trauma to our brain and it is a painful for our brain. So what happens when this sensation the kids have, their brain goes into fight and flight mode and they cannot control. They may run, they may scream, they may shout, they may hit someone. Any such behavior can be seen because of the hypersensitivity. Okay. So when they go through such sensation, the focusing on anything or concentrating on any task would be very, very difficult for them. It is like if I cannot tolerate the rough textures, okay, pokey texture, and if I'm wearing that, my attention would be there only. Correct? Since I am a neurotypical person, I may not start shouting and screaming or hitting someone, but I may not be 100% focusing on the activity what I'm doing. And that I'm sure most of you would have realized that because of the hypersensitivity. Okay. Another is a hyposensitivity. Child does not register normal level of stimulation. If someone touches me, I may not register. Unless that touch go at the high intensity, then only I will register. So if you call a child, child may not register. If you give some instruction, child may not register because of the hyposensitivity. Often does not feel or hear or see or smell common sensation unless they are intensified. Okay. The child who stumbles around because the body does not sense the contact with the floor and objects around. This is a hyposensitivity. So to get that feeling or to understand that sensation, child may do it again and again. Okay. He may push someone, he may hug someone, he may hit someone harshly, so that that sensation is registered with them. Okay. Okay. Now we are going to see behavior in each system. If it is a hypo or if it is a hyper, what do you see? Okay. Just go through it. Has anyone seen such behavior in children? Can anyone like to share something? So children, those who are hypersensitive to tactile sense, these children are always alert. Okay, they are always anxious because once they touch something, as I said, it gives a negative feeling. It gives a trauma and a pain to the brain, registered it as a pain to their brain. So they are always then alert that they should not get this sensation again. And the brain is in a fight and flight mode most of the time. Very anxious they are, very a lot of anxiety would be there. Okay. And they would be like, see, if it's like if someone touches me, which is not giving me a good feeling, I would be always very agile and alert when in that environment. So this happens in the classroom also. If the child sitting next to this child who is a hypersensitive to touch, touching him unknowingly is registered as a painful experience. This child, next time when other child coming close to him, he may push him, he may shout or scream, he may bite, he may run away from that place, and it would be difficult for him to focus in the classroom. So this can also be one of the reason when the child is not able to focus. Okay, because of the hypersensitivity, in his tactile sense, which we see lot in ADHD. I have seen that children with ADHD very hypersensitive to touch and also to sound. These are the kids, they struggle so much in the classroom. And when they are in this state, they cannot focus, they cannot copy from the board. Okay, they cannot attend what teacher is telling or follow the instruction. So sometimes the writing may not be the issue. Child is not writing, but directly the writing is not the issue. It can be this also. So because of this also, child may not be focusing and writing in the classroom. So that is why whatever you see in a classroom, we need to have a detailed assessment, okay, and understand why child is doing what is doing. Okay, clear? Now we should.
So, ma'am, is there any this thing you have seen that the hypersensitivity is more than hyposensitivity in the children, or it's usually there's no
Nothing like that.
nothing?
And in autism or ADHD, you see at times the child may have both. They would be hyper to some sensation and hypo to other sensation. Okay.
Oh,
So
oh,
that's why the detailed assessment is needed. And see, we cannot come to any conclusion by seeing the child in one setup. Okay, when
right,
I do
right.
the assessment, I will ask parents, okay, how is he at home? How is he at school? What is he doing? When you take him to the park, when you take him to the mall, what is he doing? In a different setup, we need to understand what child is doing and then form a hypothesis. Yes, this is because of the sensation. Okay.
Ma'am,
Yes.
ma'am, just now I'm doing the special education, ma'am, a B.Ed in special education, but still I'm not able to understand the difference between the ID and autism and ADHD, ma'am. Is it possible single student can have the both ADHD and ID, ma'am?
Yes, it can. It can have, okay? Can have. See, autism is a spectrum, okay? In that you will have a children with good cognition also and children with the low cognition also. Correct? Correct?
Yes, ma'am. Yes, ma'am.
Yeah, correct. So now depending on their behaviors, okay, what they are doing, what type of strategy they are using, okay, that also tells us whether the cognition of the child. When you're trying to teach them, okay,
Okay,
and
ma'am.
if the child is not able to learn, we first need to check the sensory integration issue, okay? We
Yes.
work on that. But still child is not able to learn,
Okay.
then we think about the cognition. The cognition is an issue, correct?
Yes, ma'am. Yes, ma'am.
Yeah.
Okay.
So it is something that whenever you're working with any child, you need to understand the child in a detail and in a holistic way to
Okay, ma'am.
understand. There is one slide. I'll be talking about it. Okay.
Yes,
Yeah.
ma'am. Thank you, ma'am.
Yeah. Auditory. See, this is something you see in a regular school. Lot of kids with autism, ADHD, LD, they are sensitive to loud sound. Again, this sensitivity is also once they've gone through that in anticipation. It's, for example, if the school bell is going to ring, and that is something that sound the child cannot take it. Okay, it's a bad experience for the child's brain. So now every time before the bell is going to ring, the child may show some behavior, child may act out, okay, child may run away, child may push someone, because he in anticipating that this sound is going to come and it's going to trouble me. So a lot of time you see the sensitivity to loud sound. Hyposensitive children, they may not register. If you're calling them, they may not respond to their name call because they are hyposensitive to that sensation.
Hi, ma'am. I just wanted to add my perspective.
Yes.
I have comorbidities, and sounds are something that really bother me. Shrill sounds, especially. And then I get tinnitus and it starts ringing. So what I've done over the years is get either noise cancelling headphones that dull the noise, or you get products now that specifically tune out certain frequencies of shrill sounds or low sounds. So that's something I use with my students to like make them focus. So it's a
Correct,
nice aid for reducing noise in general for anybody.
correct, correct. So some strategy we need to use, correct?
Excuse me, excuse
Mhm.
me, ma'am.
Yeah.
Good afternoon. Namrata here. I just want to ask you, like, if we are recommending for a head noise cancellation headphone, if the
Hmm.
child is more having sensory issues, not ready to wear that headphone.
Hmm.
So,
Hmm.
what
Hmm.
are the other strategy we can use it?
Okay. First of all, what is the age of the child?
The child is in grade 6,
6. Okay.
like,
Going to,
yeah, yes,
huh.
12 years, 12 to 13 years.
Going to regular school?
Yes, mainstream school, ma'am.
Hmm. See, we need to see that because of the hypersensitivity, when the child is getting overloaded, okay, and with the overloading, is he going into meltdown or what behaviors you are facing? So try and make the chart of it, okay, data. And if the child is not ready to take that head noise cancellation, you can take out the child from that environment before the behavior is going to happen. Okay, so that whatever overloading is happening, child regulated out what are the regulators for the child, the sensory preferences child is using, and try and give that so that the brain will get regulated and overloading may not happen. It's not that all the time you need to use only the noise cancellation headphones. Okay, there are other strategies also can be given. If when you choose something, that is a time also you dampen surrounding sound. So depends in which environment child is. Some strategies can be given depending on the age of the child, depending on the cognitive level of the child. The strategies can be given. Okay,
Okay, ma'am.
if you can give
And
me a detailed information about child, I can give you some strategy. Okay.
I'll do that. And
Or
one more question, like the
huh,
child is grade 7, and the child is having the diagnosed with the ASD and having the spitting issues. Like he is the behavior is spitting.
correct.
Always he spitting on his hand and
Hmm.
also play with that. So playing with it, I understand that's a sensory. So
Hmm.
what is the behavior causing that spitting? Because he's not getting anything to visit with, or
See,
what could be the
it is very, very difficult to say something just by this information, because I told you, no, the writing may not be the issue, but because of the sensitivity, child may not be doing it, or child may have some behavior because of auditory hypersensitivity, maybe anticipation he will do that. So there has to be some more information about the child to come to conclusion that yes, this behavior is happening because of this. There can be multiple reason for the behavior. I'll show you one slide. Look at this. Every behavior is a communication. What you see is a tip of iceberg. Then can be many reasons for the behavior. It
so
can
how
be.
do we identify that root cause
Yes.
which is occurring the child?
Hmm. I didn't hear you.
I said, how can we identify with the help of assessment?
Absolutely.
Identify what is the trigger for the
Absolutely.
child.
Observing the child in an informal setup, in a formal setup, and then come to the conclusion. We use a standardized format also, and I do a assessment by asking parents, observing the child in an informal setup at school, and then decide, oh, this behavior is because of the tactile, okay, issue, or it can be because of vestibular. And see, brain is a one part, everything happens here, so everything is interconnected. If the child is having tactile hypersensitivity, you may see something fall out in attention, or you may see some issues in his other system, vestibular system. So we need to understand child in detail, which is very, very important. It doesn't work. Okay, he's running around, he's vestibular issue. He's doing this, it's a tactile. No, not like that. In detail, we need to understand the child, okay? Understand the cause of
So in
behavior.
that case,
Hmm.
in that, which assessment we can recommend to the parent to go for,
Sensor
or can
integration assessment.
the integration assessment?
Yeah,
Okay.
sensor integration.
And when
That's
the
not.
child is also, and I have seen the
Hmm.
child is also knocking on a table, glass, or
Correct.
anything. Is that a sensory issue?
It can be. It can be. It can be hypersensitivity to the sound. Okay. Okay. See,
Okay.
something what child is doing is trying to organize himself, regulate himself, but the child may use a wrong strategy which is not socially appropriate. So
Correct.
whenever parents come to me, I would ask them, what is the child doing in that environment? And also what parents are doing, how they are reacting to it, that also decide whether the behavior is going to go up or going to reduce. It's a complex. It's very, very complex. So this is, in this class, my goal is that you people understand. Okay, you may not be able to analyze completely, but at least understand that behavior is a communication. Child is communicating
So,
something which is not right, something which is difficult for him. He's trying to communicate through his behavior. Got it?
yes, ma'am, is there any checklist where we do observation in a
Yes,
mainstream
yes. There is a profile, sensory
child
profile.
has
Yeah.
issues?
We give it to
So,
parents.
so
Yeah.
that we,
Sorry.
based on that, we can refer the child. At least we can send the child for the sensory integration assessment outside for.
Yeah.
But
Whatever I
is there
showed
any
the slide,
basic?
what do you see the
Oh,
behaviors at early age, at the preschool, at the school level? There were 4 slides, correct? So these are the red flags. What you
okay,
see, yeah, and
sure,
then you can refer. I also said take advantage of a
sure, ma'am.
plasticity of the brain, which is a maximum till 7 years. Okay.
Thank you so much, ma'am.
Yeah. Next is a taste and smell. Vestibular. Lot of kids, you would have seen that teacher would say not sitting in the classroom, they are moving around, they are jumping around, they do a lot of activity, they need lot of movement. But why they are doing it? They are doing it to regulate their nervous system, their brain. When they get this information, the brain is calmed down, the brain is regulated, but they don't know how much is enough for the brain. So they do it more and more. They try, they do, they get seeker, okay? They take more and more information. And that also, oh, I mean, not helping them to focus.
Ma'am, can you go to the taste slide?
Sure.
Uh, I had not read it. The taste, yeah, taste. Thank you.
Yeah. A lot of kids on autism have a feeding issues, correct? So they are hypersensitive to some taste. And the sensation of smell goes directly, when we talk about smell, it goes to our emotional center. Why do all of us put perfumes and the body spray? Because it immediately elevates our mood and emotion. So this also have seen, even in LD have seen some smells they don't like it, some smell they like it very much. If they are hypersensitive to some smell, it means they are regulating their brain through that smell. So such children should be given a that smell which they like. So it helps them to calm down and regulate. Lot of parents have told that it smells like a jasmine or something if they like. When they are studying in that room, you can put that smell, okay, so that it is a calming for the brain. What does the aromatherapy people do? They do that only, no? But in that, whatever the child's brain is liking it, hypersensitive to what which smell, that we need to use. This is a proprioception. Very floppy, muscle tone is poor, clumsy child, the coordination and balance may not be good, they bumps and crashes into things, not aware of their body positioning. When they are writing, they would always lean on one side, they will put their head down. This is all because of their postural stability. Their core stability is not good, which is that's why they're not able to have that upright posture and focus and pay attention.
I have a
Yes. Any question? No? Yeah. Now we have learned about all the sensory systems, what happens when it is hypo and hyper. Now we are going to talk about when the sensory overload happens in the child's brain, which normally happens in the classroom, in a special educator session, or even on the mall or school. So this occurs when the nervous system is bombarded by an intense stimulation, too much of stimulation. As the Gene Iyer says, the traffic jam, the chaos happens in the brain, correct? Nervous system is not able to filter out or tone down the unwanted information. Every information from different senses coming to the brain and getting overloaded. Traffic jam is happening in the brain. So now it can be from bright light, humming sound of the light, the sit may be hard, some smell may be bothering, or something disturbing from internally, the interoception would be there, anything which is there in the environment can give a overloading. So with all the sensory distractions and irritations, the nervous system is in a escape or avoidance mode. The nervous system is not in a learning mode or a listening mode. So this is something happens in the classroom. Child cannot focus, child cannot, because first important thing the brain does is a survival. Okay, brain will be in an escape mode, cannot attend, and brain starts feeling insecure, it goes into survival mode, focusing on protection, not learning. So this is something all the special educators, teachers, parents should know. In this case, what happens, the stress chemical, the cortisol starts rising in the brain because of the overloading of all the sensory information, and the child's brain goes into shutdown mode. Child may put his head down in the school, or he looks like that he's not there, he's out of it. Lot of time teachers would say that, ma'am, he's zone out, okay, or he's out of it, he's not attending, it's not focusing. But that's because of the overloading which happens. In a way, shutdown is the way of brain protecting the sensory overload. If it keeps on happening, we don't stop that time, okay, then the child's brain goes into meltdown. And the meltdown can be anything, any behavior can be there in the meltdown. And at times it's very difficult for, child gets aggressive. Child may start throwing things, child may start screaming, child may start hitting. He wants to just escape that situation. So he's not in a learning mode at all or a listening mode at all. Just read this. Sensory overload is a personal experience somebody is written. What do they feel? See, all of us also have a way of regulating ourselves, correct? Say from after the day work, when I'm tired, I come home and I may would like to have a tea or a lie down or watch a TV, correct? So that is what we are doing, trying to regulate the brain so that we are ready for the next task. So some brain can work for 5 hours, some can work for 3 hours, some can work for 8 hours without having break or without having some regulation. And some brain may require a regulation after every half an hour. So it's how the brain is wired. Okay. So every child has a different way of regulation. There will be some sensory preferences to regulate. Some children would like to look at TV, some children would listen to the music, some would like to touch something or just lie down or play with colors, lot of things. So always try and find out what are the sensory preferences of any child. And that is something to be used at regular interval in a controlled manner to regulate the brain. Yeah, this already said. Behavior is a communication. Now, after listening to all this, whatever behavior is happening, you can put it in the center and then think about, is it auditory hypersensitivity? Is it attention or a cognition issue? Is task very hard what I'm offering to this child? Does this child have gone through a previous bad experience? Okay, and because of that experience, he's avoiding the task. Or is a visual perception an issue? Something like that. You need to think about the each behavior. If you are a parent, also you can do that. If you are a special educator or a teacher, you can do this. At least after this class, I'm sure all of you can understand that yes, there are some sensory issues are there which is bothering to the child, and we are seeing these behaviors. I may. So depending on that, if the child is a more aroused, you have to give activity for down regulation. Or if the low aroused, the passive child, you give a activity for alerting the brain. There are a list of activities for down regulation or up regulation. I will be showing you that. Okay. Okay. Till now clear. We are coming to now emotional regulation. I'll show you the list of activity before, okay? Yeah. See, these are the calming activities. So if you feel the child is very hyper and highly aroused, this will help him to calm down. So these are the activity we use in therapy. Even can be used by a special educator after understanding the need of the child. And if the child is very passive and not participating, if you feel that he's not interested in doing anything, these are the alerting activity. This will alert the brain. So that child will be able to focus better. But for that, you should know the assessment should have been done in a right way to understand the sensory needs of the child. What are the hypersensitivities there? Accordingly, you can give all this. Okay. It's not that one size fits all. It is individualized. For every child, it is different.
Ma'am, can I see the previous slide, please?
Yes, sure. See, when you're working with the child, as a special educator to get more attention and the focus, okay, for a long duration. If you know about the sensory needs and if you incorporate that in your session, you will get good results. Okay, child will be able to focus and attend much better, much better.
Thank you, ma'am.
Yeah. Okay, we are at the emotional regulation. As I said, the sensation, whatever child is getting, has an impact on the emotion or your emotional brain, right? So, a lot of time because of the overloading or some frustration or something child is upset about, he gets emotionally dysregulated. When the child is emotionally dysregulated, you see lot of behaviors, because what do we mean by emotional regulation is understanding my feeling, take care of my feeling and responding appropriately. All of us do that, correct? Even in, we also get upset, we also get frustrated, we also get angry, but we try to regulate ourselves. What, how do we regulate ourselves? It is the inhibition comes from the higher center of the brain, the prefrontal cortex. The inhibition comes and they try to calm down the emotional brain. But most of the time our kids, they live only in emotional brain. Their pathways to the higher centers are not developed. So inhibition is not coming from the higher center to calm their chaos. And that is why our kids need a co-regulator. They need someone to regulate themselves. Even most of us also have a co-regulators in our life, correct? Our friends are there as a co-regulator, our siblings, parents, partner, correct? When we also go through that emotional dysregulation, we need, a lot of people can regulate themselves. Some people need some co-regulator. Some people know that, okay, I lie down for half an hour, I would be fine. I watch a TV for some time, I would be fine. So this is how you are trying to regulate yourself on your own. Some people will call a friend, correct? Some, they say, okay, let me go out, let me walk for some time. So these are, we are coping up with our emotional dysregulation. Our kids have a difficulty with this. So they need a co-regulators. This I'll talk later. Okay. What is a co-regulation now? It is a supportive process between the child and a caregiver, normally a parent or a teacher, okay, or a young adult, which fosters co-regulation development in the child. So it is between two people. Co-regulation is always between the child or any adult and another co-regulator. Now the co-regulator, the who is there, he or she should be regulated. The child when get dysregulated, the child is borrowing a calm from the co-regulator. But if the co-regulator also is anxious and having lot of anxiety, restless, you cannot calm the child nervous system. So regulation of the co-regulator is very important. So if you are, as a parent, if you are dealing with your child tantrums, frustration, dysregulation, or as a special educator, if you are not regulated, you cannot achieve co-regulation. And it is through the co-regulation the child brain will learn to regulate independently. It's a process. It takes time. It takes years sometime, okay, to do that. Is this clear?
Yes, ma'am.
Yes, ma'am.
Any questions? It's not easy, okay? The way I'm telling you looks easy, but it is not easy. It's not easy. See, just read this. The person who is co-regulating, okay, every word and the facial expression or the gesture action on the part of the parent gives a child some message about the self-worth. The tone of the parent or a educator matters. The facial expression, gestures, everything matters to the child's emotional brain. If they show that expression of disgust or jittery on the face of the parent, they feel that I'm not good enough, I'm not lovable. And that reduces their self-worth and self-esteem. And that in turn reduces their focus and attention. So see, the emotional regulation through co-regulation is so very important. It is a relational process, okay, where you are lending your calm to a dysregulated child. And if you do it continuously over a period of time, the child will learn the regulation. Over a period of time, now the therapy concept and everything has changed a lot, and it has become more relational. That co-regulation is very, very important. Emotionally regulating the child will give them a self-worth, improve their self-esteem and confidence. They feel that, yes, we are lovable and there is someone who is there to help us out. When you are co-regulating the child, you are in that pain. If the child is dysregulated for some reason, okay, and is going through some pain, if he wants something, if he's frustrated about something, that's a painful process for the child. But the co-regulator, through their facial expression, through their body language, and through their calm, convey the child that, yes, I'm there with you in your pain. I understand what you're going through, and I'm here to help you out. A lot of people feel that self-regulation is not a self-regulation is a self-control, but it's not a self-control. In fact, when you are regulated, what makes a self-control possible? If you are regulated, you can control your action and your emotion. It is not that all the time you need to be in a self-control. Look at the co-regulation visuals, how it needs to be done. Go down at the child's level, eye level, and be there in the pain, okay? Look at the expression of this mother. Look at the expression. I understand you are going through. I'm there with you in your pain. And she is lending her calm to this child to calm down, to regulate. You can't pour from empty cup. Take care of yourself first. The co-regulator has to get regulated first. I always tell mothers, those who come to me, that do things what you like. If you are in a good, state and you are regulated, you can co-regulate your child. Otherwise, it's not going to happen. Mothers or parents can do something. If something has happened and suddenly child gets aggressive, the parent or a special educator has to calm down first, take a deep breath, and then approach the child and try and understand what difficulty that child is going through. Clear?
Yes.
Any questions?
No.
No? Okay. Whenever you are working with any child as a parent or a special educator, few things just keep in the mind, okay? Support the child. Do not pressurize. It's not going to help. Difference between can't and won't. What do I mean by that? Understand that it's not that child does not want to do something, but he can't do. Understand the difficulty what child has. look at the cognitive level of the child, the sensory issues what child is going through, also look at the emotional co-regulation, and then come to the conclusion. But always whenever you see the behavior, it is the child is trying to communicate something. Child is having a difficulty, so he or she is not doing. It's not that she doesn't want to, she or he doesn't want to do. Never jump to that conclusion. Okay. These kids, most of our kids will have a processing issue. That processing will be little slow compared to the neurotypicals. So give a child a time to process. Don't bombard them with the instruction continuously. Come on, do it, do it. I'm telling you to do it. I'm here, this, that. So many times I've seen parents and professional talk so much, which is only overloading the child's brain. And you are shifting the child's brain to shutdown or a meltdown. I have worked with so many kids where I have told parents not to overload child with unnecessary instruction, and now they've understood it, and they talk less and don't repeat the instruction, don't bombard the instruction continuously. The children are doing so good. They are doing really good. Because with our instructions and too much of pressure what you are putting on the child's brain, you are pushing them for overloading, shutdown, and the meltdown. So shorten your words. Okay, instruction should be given once or twice. Then you can use a visual prompt or some physical prompt, some gestures. Don't keep on repeating. This slide, I feel as a professional or a parent, please keep it in the mind. Anything you don't remember, this is something you need to remember. Then your child will bless you. Okay. Use visuals, especially when you're working with ADHD or autism. Wherever needed, use a visual. Break down the task. Slow it down. Okay. Understand the difficulty what your child is having. No, he can do it, but he doesn't want to do it. This is something I always hear from the parents and teachers. It can be a regular school teachers or the special educators also. I understand when regular school teachers passing this statement, but I don't expect this from special educator, because the special educator understand the child and the child's difficulty. Lot of time when I get a call from the school that this child is having this issue and not doing it, I always tell special educators, you are there in the school advocating our kids. You are the one, you should be telling other teachers also why this child is doing what he's doing. So be advocate of our kids wherever you are going to work. Okay. Teachers may not know this, but as a special educator, you will understand the difficulty of the child. Prepare by previewing. Always prepare them what is going to come. Predictability is something helps our kids a lot. Even in school also. What they are going to teach tomorrow, what can he expect in the next class. If he is prepared for, his brain is in a better position to manage that. Use sensory preferences. Whenever you are working with any child, you should know what are the sensory preferences child is having. Is child like to squeeze something, like to look at something, touch something, or he wants to be on the swing? So whatever is possible, try and incorporate the preferences in your session, okay, in a controlled manner. Okay, I'm not saying that give them for a longer time, but for the short time, regulate the brain, and then child will be available, brain will be available for learning. Pace the performance to avoid fight and flight. If the child is having a difficulty and he's been put a lot of demands on his brain goes into fight and flight mode. And that is an escape mode. The brain cannot learn. Brain cannot focus. Brain cannot attend. So these are the things, please keep in the mind whenever you're working with a child, wherever you're going to work in future. Okay. Any questions here? Clear? Good. Want to just read this? This you will see. Constant motion, child is not able to sit still.
Hi, ma'am. This is Sarah.
Sorry?
This is Sarah. Yeah. My child is 5 years old, ma'am, and he has lot of teeth grinding.
Teeth grinding, okay.
Yes, ma'am. Is it comes under sensory only, ma'am?
It is. Any time coming to conclusion whether it is sensory or not, first you need to rule out whether the child has a worms or not. Lot of time the grinding is because of the worms also. So clear out that, meet any doctor and give a deworming. Still it does not go. Yes, it is a sensory because our gums here have lot of proprioceptive receptors. And the moment that is grinding is done, the pressure what they get, it's a very calming for the brain. Okay, so now make a data, when is it doing? So whether while doing any task or at night, and accordingly we need to plan a sensory diet for him, for his brain to become a calm down, so that he does not use this strategy to calm himself.
Yeah, mostly he does when he is idle. He has no work. At the time he will be doing, ma'am.
Correct.
Like when he feel bored.
Correct. So that in that case, try and keep him engaged. Okay. And when he's doing it with ideal, you give him some crunchy food, something to chew that time, so that the grinding will reduce. Correct?
Okay, ma'am.
Yeah. Give him
Thank
a
you.
regularly crunchy food. Try to make him engage or do things where he has to apply some pressure, where he gets a proprioception, so that he does not have to use this proprioceptive receptors to calm himself.
Okay, ma'am.
Okay.
Thank you, ma'am. Yes, ma'am.
Yeah. This also in classroom or in a setup happens if they are visually they are seeking some information and they get overwhelmed with the visual stimulation, and then finally they'll end up into overloading. This also you would have seen, hand flapping, most of the kids. Always when there is a behavior happening, no, take a data. When is it happening? What time it is happening? What is child doing that time? To is he using any strategy to stop that behavior? How is it then progressing? What people around a child are doing that time? All that data should be there. Then it is easy to analyze the behavior, why child is doing, what is it doing. Okay. This we have done. Okay. So when I spoke about the emotional regulation, provide a lot of security to the child. Okay. Unconditional love should be shown. Set boundaries. Boundaries should be very clear with these kids, with the firmness. If the child wants to watch a TV for a longer time, if he doesn't want to do academic task, okay, it should be very clear. Okay, you don't want to do now, but let me know when you want to do. And then see, doing a task is a non-negotiable. If not now, when? Something like that. It should be very, very clear boundary with firmness. If child wants to watch a TV for a longer time, if he cries, You can say, yes, I know you want to watch a TV, you love watching TV, but you cannot watch more than half an hour or more than 40 minutes, something like that. So this boundary should be clear to our kids. When it comes to the ADHD, these are the kids, they always live on the edge. They want to cross boundary. Because when they cross the boundary, the dopamine hit happens. And they see a lot of people, adult also, even neurotypicals, they want to do things which they are not expected to do. Correct? They want to always cross the boundary. So boundary should be very, very clear, and it should be taught and told to the child with firmness or not by conditioning. Okay, if you do this, you can go down. If you do this, you can get. No, you have to do this. Be firm, non-negotiable. That is how it should be spoken and conveyed to the child. Yes. Engage and involve the child in the things what they like. Always start from there, what they like, and from there you can make them do the things which they don't like. Understand the sensory needs and preferences which needs to be fulfilled in a right way. Appreciate and reward, which is also very, very important. Okay, very, very important. These are some activity. Want to see this activity? What is proprioceptive activities?
Yes, ma'am.
Yeah. These are the activity normally we do it in a therapy session. Also is prescribed to parents as a sensory diet, which I'm going to talk about it, depending on the need of the child. As I said, every child is different, the needs are different, sensory preferences are different. So it is a tailor-made for every child, not that one size fits all. These are to understand the awareness of the body. This can be done even in a special educator sessions also. Okay, incorporate this activity in your session, give them a break, regulate, make them regulate, okay, through co-regulation and through sensory regulation. Then the brain will be available for the learning. Their focus would be better. These are the executive functioning deficits children have. So understand the difficulty, understand the difference between can't and won't. Sometimes they don't even understand what is expected out of them, because the person who is working gives so many instructions, verbal instruction. From that, they cannot, they cannot process all, and they don't even know what is expected out of me. So be very clear what is expected out of you. The boundary should be very clear with firmness, that should be taught. That's all we've done it. Okay, see, these are some positive things to tell to the child, okay? Not only you are a good boy, good girl, oh, you did this, no. And never think the child is not understanding. They do understand everything. They understand your facial expression, your tone, your body language, everything they understand. This is also very good slide, especially for the parents and the special educators. Forced compliance is not going to work. It is a relational process. Through co-regulation, you can calm the child. If they're angry, they're upset, go down to their level, try and co-regulate them. Don't use too many words. Say it's okay to be angry. Okay. But what you can do when you are angry, what you can't do, that need to be taught to the child. Again, the way you taught it, it depends on the cognitive level and the age of the child. This slide, if I have a time, I will come to it. Okay. See, these are the sensory regulation areas should be there in the school or in any setup. Even the special educator also, if you have a setup, just keep a small area where child can regulate. This decide their self-worth. Okay. When there is a self-worth, there is a self-motivation. Motivation is there. It will improve their self-esteem, confidence, and their attention also. Cannot make child feel bad about the behavior, then expect that the child has to focus and attend. It doesn't happen that way. Yeah, this is also very powerful slide. How the caregiver or the parents react to the behavior, it decides if this behavior is going to go or up or down, and over a period of time it becomes an established behavior, learned behavior. Unfortunately, parents also may not know, but it happens. It's that way. Yeah. So now after doing the assessment, understanding each sensory system, how child is functioning, what are his sensory needs or what are the sensation is avoiding, depending on that, we plan a sensory diet for every child. It is a tailor-made, okay? It is to keep the child regulated and organized throughout the day. And it is done by occupational therapists after working with the child for some time, after understanding a child. Autism is a neurological condition which often leaves the nervous system out of sync with the environment and around it. Nervous system has a difficulty processing sensory information effectively, and it is often left unorganized, disorganized, overwhelmed. So because of all that, we have to prescribe a sensory diet to keep the child's brain regulated throughout the day so they can focus, they can function, they can learn academic tasks. Okay. That's a sensory diet. And look at this typical sensory diet. This is something can prescribed at school. So before the behavior happens, if the break is given and if the child is following sensory diet, you may not see a lot of behavior in classroom, and child will be more focused and attentive also in class. That's how sensory diet helps. Okay. I don't think we can take this now. Okay. Meltdown and shutdown or tantrum. This is how the therapies are done in therapy room. It's look like a play equipment, but through this, we work a lot on getting adaptive response, and with that, lot of neural connection happens, and the child will improve with therapy. So with this, I will stop sharing. I'm not getting that. Okay. So any questions? I will take up.
There are
Good
some
afternoon.
questions in the chat box, ma'am. The chat.
Can I ask you a question? Good afternoon.
Yes, Anita, go ahead. If you want, you can on your video.
Hello. Good afternoon. Can I
Yes.
ask you a question?
Yes, I said yes, go ahead. Go ahead, whoever wants to ask a question.
Hello. Good afternoon. My name is Anita, and greetings from Kenya here. I work with a mainstream school, and there is a challenge with one of our learner who is diagnosed with this on the spectrum. Now, this child is living with the caretakers and aunts and uncles because the parents are not here; they are overseas. That is a first kind of a challenge. The second challenge is this child has a silent epileptic episodes. So due to that, she has put on a heavy dose of medication, that almost 5 tablets in the morning and 5 tablets in the evening. So even though probably she must be sleeping, but her brain must be active throughout the night. So when she comes to school in the morning, her eyes are always droopy and she's tired. All right. Now they have put her in the mainstream school. So as possible, the mainstream school have a lot of activities, a lot of noise going on and everything. She doesn't want to sit in the class, which demands a lot of learning. She doesn't want to sit in the class. And when she is dysregulated, she's all of a sudden she will cry and she starts hitting her face.
Correct. Correct. Yes. Anita, how old is the child?
Now, sorry?
Child, how old is the child?
Okay, the child is 7 years old.
7 years
She's
old.
7 years old.
School, can I
Yes,
know
she's
which
7 years.
school she's in?
She is in a school called Al-Amin Academy in Nairobi, Kenya.
Okay.
I'm calling you from there.
Okay.
I'm calling you from there.
Yeah. So this whatever. Yeah. Go ahead. Go ahead.
She's taken in the school. She's taken care by the caretaker, not the shadow teacher. Now, the caretaker also has to work when she goes back home, so she's also tired. So this episode continues, and we have almost 30 neurodiverse kids in a mainstream school. So it's an overwhelming number.
Yes,
and sometimes it is. As a teacher, I don't know where to start and where to end.
Absolutely.
So
it would be very difficult
becomes,
managing so many kids, and child is having so many issues. And see, he or she is having epilepsy. So yeah,
yes.
So there will be some brain damage also would be there. So whatever child is doing is not under his control. Okay. And with the heavy medication, child would be feeling very drowsy. And so the child is not able to focus. So that does not look like a sensory issues. Okay. This is the physiological issues are there. I think you have to take up with the caretaker or the parents and the doctors who are treating. They can change the time of medication so that at least when the child is coming to the school, he would be more attentive.
Okay. No, the situation over here is this is Kenya, Nairobi.
Yeah.
The medical part of it is very, very challenging. There's a reason a lot of parents from here, they travel down all the way to India with the children on the spectrum and ADHD to be treated and to be given a kind of a program.
Correct.
Here, this is the third doctor they have changed over the period of on this 2 years. And every time the number of medications have not changed. And the worst part is the parents are not around. So none of them, neither the class teacher understands, even though she might understand, but she doesn't want to kind of give much time because she has regular 20 kids, neurotypical children in that class.
So good, correct. I'm sure the child would be struggling. And yeah, the way you are describing, Anita, I understand it would be very difficult for you also. But in that situation, whatever best you can do to support the child emotionally and physically, I think you should do that. What else? You can't change the system, or you can't do when the parents are also not around. At least understand that the child is struggling in this environment, understand the difficulty of the child, and try and support whichever way you can, Anita.
Yeah, I'm trying to do because it's heartbreaking to see her when she cries. It's
Yeah.
really heartbreaking because she hits her face. She
Very
hits her face, and then you can see the lot of tears coming from her eyes, and then heartbreaking because the parents are not around and nobody understands. I try as much as possible, but it is not possible for me all the time because I have to manage other kids too.
Anita. But I'm sure you're doing your best within your capacity and continue
I don't
doing that
know.
to help the
Sometimes
child.
I'm stuck. I'm stuck whether maybe I'm not doing the right way, or maybe I'm not doing, the way it should be. So it's a kind of a beating kind of a position I'm in sometimes. So that's the reason I was talking to you how to go ahead with that, how to do, kind of, make a
The way you're
progress.
describing, I know it's very heartbreaking. And I'm sure, so much that child would be going through. So whatever best you can do, try and help the child.
All right. Okay. Thank you so much for your time. Thank you. And thank you for such an amazing the workshop. Amazing. It is amazing. Thank you so much. God bless you.
Thank you so much. My goal is always that
Thank
those who
you.
are attending the workshop or a class, you should learn, and then you can transfer that to any child and who gets benefited from this learning. Any other question? Today, surprising, there were very few questions.
Hello, Dr. Priti. There were a few questions in the chat box. I don't know if you're able to see them.
Yeah. Can you read out?
Yeah. The first one was, okay, let me go with the last one. Hi, ma'am. Can you please suggest some measures for interoception? Might have missed this slide.
Interoception?
Yes.
What she wants?
She wants some measures for interoception.
Some message?
Measures.
Measures. Oh, okay. Some measures for the interoception. Yes. Who has asked the question? If they can tell me more about the child, their age, the diagnosis, what you are facing. See, depend. Interoception can be any difficulty from within. So always whenever you are having any child having dysregulation or any difficulty or a shutdown, meltdown, first check on the interoception, whether the child is eaten properly or not, whether the child slept properly previous day, or whether the bowel was cleared or not, anything where any pain is bothering the child. So always first look for the interoception and work on it. And then if not, then it is you then find out and put that behavior in the center and possible reason for that behavior. So look for interoception. Is there an infection? I remember one child, 7 or 8 year old, during therapy session, he was crying so much. And we tried to regulate him. The parent was co-regulating. And then suddenly I said that, is there any internal issue is there? And then realized the mother said, yes, he's having some urinary tract infection. So that was bothering him so much. So always try to check first, is there any interoceptive issues are there? Try and work on that. And then later you can give some sensory strategies for it. Okay.
Thank you, ma'am.
I hope I answered.
Lekhani has a question. She's
Okay.
raised her hand.
Next.
Lekhani?
Yeah. Hello, ma'am. Good evening.
Hi.
Yeah. Thanks for a very beautifully insightful session, ma'am. Such a wonderful.
Thank you.
Yeah. Ma'am, I have two queries. One of my student, he is a ADHD. He starts repeating a word or phrases continuously. Like one word, something like he heard help. So he started continuously help, help, help. Every time, kuch bhi karo, like that. Na? So how can we change it?
Okay. How old is the child?
He is around, ma'am, 8 at mid, 8 to mid.
Okay.
Nine,
Going
nine.
to regular school?
Yeah, going to regular school.
When does he do? When does he repeat the words?
When we work with him.
When?
जब भी हम उसके साथ बैठ के काम करते हैं, जब भी
We
like
काम करते
हाँ
हैं.
right
Okay.
पढ़ाने.
Okay. Now see, first we need to find out what is this, the repeating word is serving to him. Okay. What is he getting out of it? Many a times when the demands are put on the child, he may repeat. That's his way of regulating himself.
Okay.
It can be that, correct? Can be one of the reason.
Okay.
Sometimes it can be to avoid the task.
Okay.
Okay, it can be that also. So try and find out, when is he doing, how many time he does it, does he stop after without telling him, or the person has to tell him to stop? What is he getting out of it? See, if some task is given and if he repeats and then if he's able to perform that task, that's okay. It's his way of regulating his thoughts, okay, and then working on it.
Okay.
If he's trying to avoid that through repeating the words, we can stop that.
Okay.
Okay. So try and find out. But
Okay.
there will be some reason for this behavior. Yeah.
Okay.
So
And
once you understand that reason, what
yeah.
is getting out, you can work towards it.
Okay, ma'am. Okay, ma'am. Sure. Okay. And one more children is matlab she's very emotional. So she start crying quickly when we form with her, and she also sniffs all the things. She holds any new thing भी वो अपने आप को उसको स्मेल करेगी.
अपने आप को
मतलब स्मेल करेगी. The thing is जो भी वो हाथ में पकड़ेगी उसको स्मेल करना.
हाँ, correct. Yes. Yeah. So, Lekhani, see, now she's very emotional child, correct? She might be getting upset, frustrated, sad, unhappy. तभी वो smell करती है, that means she'll be hyposensitive to olfactory. जब वो smell करती है, तभी उसका brain calm down होता होगा.
Okay.
So now use it in your session in a right way. Give her this smell at regular intervals. So it helps her emotionally also. She'll be able to hold herself better.
Okay.
So that's a need. This is her sensory preference. Use it in a right way to regulate, correct? To calm down and to increase her efficiency and attention.
Okay, ma'am. Okay.
Got it?
Hanji. Right. Thank you so much. Thank you, ma'am. Thank you.
Anybody else?
Namaste.
Yes.
Priti ma'am, this is Sapna here. It was a really informative session. Thank you so much for that. This is about a child. He is in grade 2 right now. And whenever he is sitting in the class, he constantly fidgets, whether it's an eraser or a pencil. Sometimes it goes in his mouth unknowingly. So, which, affects his attention in the class because his mind drifts off.
Correct.
So I tried giving him the, a soft, slimy thing in his hand constantly so that he focuses. But the problem is again, then he is concentrating on that flat thing or, So how am I supposed to,
Correct. See, the way you are describing, it looks like that environment of the classroom is difficult for him, correct? He is finding difficult to regulate himself. I mean, so much demands are put on him. He has to attend, he needs to focus. So he's trying to do something. The fidget also maybe to regulate himself. So I would suggest find out what are his sensory preferences. Okay. Yeah, you have tried something, but that may not be his preference, which regulates himself.
Okay.
See, whenever you don't know, always use a deep pressure or a deep touch or deep pressure. That normally works for most of the kids.
Okay.
Okay. Yeah. So in a setup, wherever he is, whatever is possible to do that. Some heavy work will also help him. Heavy work is always a calming. It taps into the serotonin circuit and the child's brain calms down. So
So
in
heavy work as in, I didn't get that.
It depends on the weight of the child. If the child is like say 25 kg, start with the 2 kg. He can transfer something of 2 kg. He can pick up and put it somewhere. Okay. But break him. I mean, use a sensory diet at regular intervals so that he would be calm.
Okay.
Yeah.
Ma'am, one more.
Just 1 second. Just 1 second.
Sure.
Satya, Krishna can continue. I'm so sorry. Go ahead.
Another thing is one of the child, especially when there is something exciting going on, or children are running around, he feels so overwhelmed that he starts flapping. And sometimes it's really too much. He starts jumping. He's not understanding. His hands and all becomes really awkward for others to see.
Yeah.
So I tried telling him, using the therapy ball, I always told that this is open for you whenever I am there to just calm him down. But he says that ma'am, I am not able to control it. It's so unknowingly that I am doing it sometimes. So
correct. See, something that he's seeing that, okay, will be too much visually for him to take it. Okay. That movement, visual vestibular connection, that he's not able to control that. He must be feeling happy about it, excitement.
Yes.
So what strategy you need to give him that time if you are around? You can just tell him hands in the pocket.
Yes. Yeah.
Okay. Or you can tell him good hands. Okay. Or you can give him something to squeeze during that time. But never tell child to stop that. Because not again under their conscious control.
Yes.
Okay.
Yes.
Yeah. So these are the things. Just go close to the child and tell him hands in the pocket, do this, something like that. Okay. And see, if the child is cognitively good, you can always prepare him before that. Now this is going to happen. Keep your hands in the pocket.
Yeah. And I have tried last week. I did that. And he looks at me whenever he remembers that he's not supposed to, or, he has to keep it, low. So he looks at me and then he tries to put it wherever he has to. So, yeah, that does help.
Because see, as I said, no, it's not under their conscious control.
Correct.
Okay. See, when it comes to the autism, the brain body connect is not functioning well. I want something in my body to do, but my body is doing something different.
Correct.
So there is no point in punishing the child for that, but he knows he's not supposed to do, and he's looking that to you for that validation.
Yeah.
So understand that difficulty.
Yes, definitely.
Have that compassion towards him, that it is difficult for him. Just go close to him, put your hand around him and say, okay, hands in the pocket. Okay. And when he does that, see, over a period of time, his brain will learn that neural connection will happen. Okay. That he may not need anything from you, any suggestion from you. The brain will learn, understand that. Okay. Through the connection. And then, and every time he does it, just give him some motivation. Okay. Oh, I like the way you did it. I like the way you keep your hands in the pocket. You look so smart when your hands in the pocket. Something like that. Okay. That will motivate him.
Okay. Thank you so much.
Yeah. If people are okay, to video on their video, do that. And I would like to see you guys. If those who are okay. Those who can do.
Yeah.
Okay, hi, Nisha did that. Nice. Okay, Sangeeta, yes, Arpita. Okay, Priyadarshini, Sunita, yes. Okay. I always tell special educators, you people play such an important role, okay, in child's life. We are there as a therapist, but you people, you are advocating them wherever they are, whichever school they are going, even at times to their parents also. So the way you people work, the job you people do, it's superb, superb. So all the best to all of you. And I hope this learning helps you wherever you are going to work. Anytime you need any help for any child, you can message me. Okay.
Ma'am, just need one info. So I would like to know where your therapy center is located and
Nisha, I now operate from my home. Okay. So take my number. Anybody needs, just WhatsApp me. Okay.
Sure.
I do
Which
online
part of
also.
Bangalore, ma'am? Which part of Bangalore?
I'm near Marathali.
Okay. Okay.
Yeah. So those parents who are far off, they come to me Saturday, Sunday. I do work Saturday, Sunday also for the parents, those who are coming from far off, and online also I do.
Okay. Okay. But generally you do OT, ma'am? I mean,
I am more into parents training. Okay. After doing the assessment, I make parents understand first. Okay, about the child, make them aware about the child, give them a proper sensory diet. Okay. And which they follow, and then review is done after 2 months. See, nothing changes overnight. So whatever program I give them, they need to follow, they need to work. I am available to them for that 2 months. When they start working, if they have a difficulty, they message me. And then again, I help them out. But after 2 months, then review is done. What is child doing? Whatever you tried, whether it worked, it did not work, something else, like that. Okay. See, the brain, you understand through their behavior only. So I also understand child, what they're doing in the setup. You can't open up the brain. So what is happening at what level of the, which part of the brain, accordingly then program is given. See, lot of our kids know they live in an emotional brain only. The inhibition from the higher center, what we call as a prefrontal cortex, which is our thinking brain, our analyzing brain, that pathway, top to bottom pathways are not developed only. So they are always very emotional. Anything happens, they start crying, screaming, or emotional dysregulation keeps on happening. But these pathways develop slowly through the co-regulation from the parents. So this is something parents have to understand how they need to do it. And it works, okay? It works for every child. It's a relational approach. Superb, it is superb way it works.
You do online sessions as well, is it, ma'am?
Yes,
You do it online as well?
I do online also.
Okay, okay, thanks.
For online, I tell them to send me the videos of the child, and then we discuss.
I'd like to request Sharavana to give the vote of thanks, ma'am, today for today's session.
Yes, ma'am.
No questions? We can stop?
Yes, ma'am. In chat, there are some questions, I think. About setting up a sensory room for therapy, there is a question in the chat box.
Okay. Can you read down? So can someone read? Let me see in the chat. 1 minute.
I'm not able to see that. Where is it, Sharavana?
It's in the beginning, ma'am. Let me just read.
Is Vijayalakshmi Anbu here?
And I can't see it. They are saying it's low.
Vijayalakshmi Anbu's question, I think.
Yes,
she wanted some inputs about setting up a sensory room for therapy. I don't know if she's here. Vijayalakshmi?
Yes, Vijayalakshmi, what is the question? Anita, yes, definitely let me know when you are coming and we will meet. And from there also, Anita, if you have any issue, you can WhatsApp me. I will help you out to best of my capacity and ability.
Thank you so much. Thank you so much. As since you
Anytime
said
about
that
any child, if you
Yes.
want to discuss, please WhatsApp
Yes.
me.
Yes. Can I refer your number to the parents? The
Yes,
parents over here.
yeah.
The parents
Tell them
are
to
here.
WhatsApp me. Tell them to WhatsApp me.
Okay. And you can conduct the online sessions with them, right?
Absolutely.
Okay. Awesome. Thank you so much. Thank you so much for that.
Welcome.
Thank you, ma'am. I think if there are no more
1
questions.
minute, one last question, ma'am. Sorry.
Okay, please.
Yeah. Thank you, ma'am, for the wonderful session. Ma'am, I wanted to ask you regarding the ADHD, how well the medicine part will work. And even of the medicine, the child is not regulated in the CBSE curriculum because CBSE's curriculum demands a lot of attention and focus. The child is very restless. So the school demands for the play-based learning, like an American curriculum. So how well do we take this suggestion, ma'am? Because the child is not regulated. He wants continuous movement. He's not able to focus. He's writing, as you said rightly in a session also, writing would not be a difficult part. It is like they are doing forcefully. Then the child, now the school says that the child is doing all this, and if he goes to grade 4, it will be more bombarding of the curriculum. So he needs to go in a play-based learning, which is in an American curriculum. It's more playway method, and even the medicine Ritalin is given. The child is not regulated. So in this case, what is the suggestion, ma'am? Like, how well does ADHD is controlled? Because Ritalin, one of the well-known medicine, as you must be knowing, ma'am.
Yes, absolutely.
What is the outcome as a parent should know, ma'am?
See, the way you are describing, I feel the child is in the wrong placement, wrong environment, which is not helping the child. Correct?
Okay. Yes, ma'am. The CBSE curriculum. So in that case, it is good to shift that child to a American curriculum wherein they have a playway method, and it's a customized curriculum.
It's very difficult to say that which will work with the child unless I know the child. Okay, but
right now the school is saying no, he can't further go with the inclusive support also because the curriculum is vast and still
Kavita,
3
listen.
years. Yes, ma'am. Yes,
If you
ma'am.
are working with the child, you know the child cognitive level, his difficulties, you try and find out which curriculum is going to work best for the child. Without knowing the child, it's so difficult for me to say, okay, this curriculum will work or this will not work. I don't know anything.
No, and medicine, ma'am. ADHD, we're giving Ritalin medicine, ma'am. I'm talking about my own son. With ADHD, we're giving Ritalin.
I understand that medicine is very effective medicine. If it's not working, we need to see the environment. It's not always that we see the child and fix the child. First, look at the environment. What is not working in that environment? If the child is getting negative experiences from that environment every day in, day out, okay? How do you expect the child to function? So find out, I would say, dig in more what is happening at the school. Okay? Yeah.
No, they are saying that he's doing the rest work, but he's all the time in alert and irritable, not focused. More he needs more breaks. Every lecture में उसको बाहर जाना है, so he is not regulated with the schedule.
See, in that environment, child is needing lot of regulation, lot of calming down. Correct?
Yes.
So either you need to change the environment, or in that environment do something where child get the regulation continuously, where child don't have to demand for the regulation. Correct?
Yeah, they have an OT room also, ma'am. They're getting OT therapy also. They are getting occupational therapy. But apart from all this also, the last conclusion what they give is that he is not able to fit in this with inclusive support also. So you are supposed to shift him in a curriculum where he is more in a playway method. That is what they are concluding, ma'am. The school is concluding this.
Correct. It's okay. I mean, so whatever they feel, if he's getting everything but still is not able to regulate, okay, then maybe the environment need to be changed for the child.
Changed for that. That is what, ma'am. As you suggested, you give some sensory diet. No, ma'am. Maybe more. We have to dig in, as you rightly said, ma'am.
Sensory diet also one part. How the child is being, the professional, those who are working with him, or the parents are reacting to his behavior.
Correct, ma'am. Yes, ma'am.
Very, very important. If the child is doing something and the teacher says go out of the class, the child will learn that if I act out, if I do something, I will be sent out of the class. See, these kids are very smart.
Yes, ma'am.
So that would be a learned behavior. Wrong behavior he will learn. So try to
For
find out
any
in
one tantrum.
detail. See,
For any one tantrum. Yes, ma'am.
Kavita, try and find out things in detail. Okay?
Yes.
Then only
Yes,
you can come to some conclusion. Okay?
Sure, ma'am. Definitely, ma'am. Thank you, ma'am.
Any other questions?
And please share your number so that we can be in touch.
Yeah. It's there. Okay, presentation. Okay, first slide. Or Jaishri can do that. Jaishri, you told me to...
Yeah, Jayashri is, she had to log out. So I will tell her to share your number if she has it.
Jaishri. Okay, she said that she's going to form a group also.
Okay.
Yeah, so ask Jaishri, she'll give it to you. And I would happy if you can give some feedbacks, send it to Jaishri or whoever there in Vrindavan. Okay? Yeah. That what did you learn from this session? How is going to help you in your practice? Something like that. If you can give a feedback, it will help me also. Okay. Uma, you are from Vrindavan?
Yes, I'm also from Vrindavan. I'm helping out Jayashri with this.
Okay. So then you can pass my number to them, whoever want.
Sure.
And
Sure.
WhatsApp me.
I'll do that, ma'am.
And send a feedback to Uma or Jaishri. That will help me also. Okay, so all of you have a wonderful weekend. All the best, very best, wherever you are going to work. Okay.
Ma'am, just wanted Sharuna to give the vote of thanks before we end the session.
Yeah. Thank you, ma'am, for this wonderful session. We started with understanding about, that diversity, different does not mean anything less. So it was wonderful to kind of get that thought, reiterated to us. And also the many things that you told us about the senses, the sensory issues, the symptoms, how it can be addressed, and how to do the sensory integration. The biggest takeaway for as special educators, as parents, for us have been like behavior is only like the tip of the iceberg. Beneath the behavior, there is a feeling, there is a need. That complete layer by layer, how you unwrapped it to us.
Absolutely.
That has been awesome. That has been awesome. And thank you for this delightful evening with this session. And thank you, Vrindavan, for organizing this. And thank you, all the participants. It has been a wonderful session and a big eye-opener on the sensory details. Thank you.
Thank you, Sharanya. You so very well summarized it. I'm so happy. I'm so glad.
Thank you, ma'am.
Okay. Thank you and bye-bye, everyone.
Thank you so much, ma'am.
Thank you, ma'am. Wonderful session. Thank you so much.
Very wonderful session.
Thank you. Bye.
Thank you, ma'am.
Thank you, ma'am.
Thanks a lot, ma'am.